Golfing superstar Tiger Woods is in recovery this morning after extensive surgery on his right leg following that terrible accident on Tuesday where we saw him lose control of his SUV on a downhill stretch of a road in suburban Los Angeles.
Well, physically challenged from recent back surgeries, and Woods shattered his tibia and fibula and suffered damage to his foot and his ankle bone. So what does this mean for the former #1 world champion? Dr. Stephen Nicholas, founder and director of New York Orthopedics, is joining us with details on what the recovery might look like. Dr. Nicholas, thanks for being with us.
Thank you, Lauren. Rosanna, nice to be here.
When we hear that he has multiple open fractures affecting both the upper, the lower portion of his right tibia and fibula, what does that mean, knowing that he has rods in him now and screws?
Well, first of all, he's fortunate to be alive from that injury. But when you read about the reports, they say it's a compound, which means an open fracture means the bone's protruding out of the skin, which increases your risk of infection. So the first thing you have to worry about is getting through this period without getting an infection. The next issue is he's got what's called a comminuted fracture, which means it's in a bunch of different fragments. So compound comminuted fracture. And then the other thing is he's got problems with the foot. He had multiple pins and screws put in the foot. And probably the most significant thing was he had what's called a release, a fascial release. And that's because there's so much swelling in the muscle that the muscle was cutting off its own blood supply. And they had to release the lining of the muscle to allow the muscle to expand so it could continue to get a blood supply. If that's not done quickly, you can lose some of the muscle. So that can complicate his recovery quite a bit.
How much?
So while he's fortunate to be alive, I'm sorry, go ahead.
No, you're absolutely right. He is fortunate to be alive. Looking at his record of surgeries from 1994 to 2020, 10 surgeries, most of them to the left knee. But since 2015, all back surgeries. He was recovering from the latest back surgery at the time of the accident. How much is that a factor?
He was. Well, unfortunately, he had a disc operation again. He's had multiple back surgeries, and he's been an exemplary patient. He's got his body fit. He was returning to competition. He's performing quite well. He hasn't had the opportunity to get the muscles back in shape after this back injury, so that'll make it a little bit more difficult for him in the rehab process. And hopefully, also, he didn't hurt his back again when he had this injury. So that's the other thing. When we talk about returning, his first goal is to return to more normal life, let him walk with his daughter, let him play golf with his son. And then after that, when you talk about being a professional golfer, you've got to walk between 5 and 8 miles, 5 to 6 times a week. And you've got to be able to push off your foot. And that foot with the injury he has can become somewhat stiff. And you also want to make sure you didn't lose any bones. Sometimes with these comminuted fractures, some of the fragments can protrude through the skin. You can lose some of the fragments, making the recovery even more significant.
Yeah, as my husband mentioned to me last night, doctor, I mean, golfers use their feet. I mean, there's a lot of swiveling, a lot of weight on them, and especially if you're a good golfer like Tiger Woods. And would you consider that the most critical part of his injuries?
I think probably the most critical part will be the foot, without knowing exactly what was wrong. But these foot injuries can be fractures and dislocations that they can make the foot quite stiff and painful. And when you play golf, you push from the ground up in order to generate power. So that might inhibit his ability to do that quite significantly.
So what do you think the recovery?
But he's performed well in the past.
Right. He is the GOAT, the greatest of all time. If anybody can defy the odds, he can. But what do you think? I mean, is he done playing for this year?
Well, he's done playing for this year, absolutely. He's not going to be able to put weight on this leg for about 3 to 4 months, probably, put his full weight. And then it's probably going to take him a full year to recover and get the strength and all the motion that's required to play golf and to have a normal life.
What about mental recovery? Here's a man who lives and breathes this sport. It's his livelihood. It's who he is. How do you maintain a positive state of mind during all of this?
Certainly, it's going to be difficult. However, he's shown tremendous mental fortitude through all the injuries he's had and all the things that have gone on in his life. The mental toughness it takes to achieve the greatness that he's achieved is significant. So I wouldn't bet him against him with regards to his mental capability of handling this. He's got to get over the physical constraints that are going to be presented to him, but I think mentally the toughness is there in him, and I think he'll be able to do it mentally.
Well, we appreciate you coming on. I know that you don't treat Tiger Woods, but you are one of the top in New York, so we knew you would understand these kind of injuries. Dr. Stephen Nicholas, Director of New York Orthopedics.
Thank you.
We
Thanks, Roseanne
appreciate
Moore.
you coming on.
Thank you so
very
much.
much.